back.
Welcome to Section 2 of the California Patient Movement Plan. Now we're going to talk about the medical and health system description, starting with the Standardized Emergency Management System, also called SEMS.
So the basic principles of SEMS are really quite simple. One, SEMS requires emergency response agencies to use basic 5 levels and then the basic components of ICS.
SEMS also facilitates coordination among all responding agencies and facilitates the flow of information within and between the levels.
SEMS rocks. We love SEMS. So let's kind of talk about the 5 levels of SEMS, because that's really where the health and medical system fits in very nicely. So the first level of SEMS is what we call the field level, and that is really any response assets that respond out to any sort of mass casualty incident or any sort of medical incident. Next level up is the local level, and that's really a city government level. So if you're a municipality or a city and you have a fire department or some sort of a agency at the city level, that's where the local would be. At the operational area level, that's where you would have county level services. So you'd have your local EMS agency, your local sheriff's department, and those sorts of things. Up at the next level of SEMS is the regional level, and that's really where our mutual aid system kind of kicks in between different counties and different regions. So as you can see there, we have a little regional map. There's 6 regions in California. And then lastly, we have the state level. So that's the California Highway Patrol, Emergency Medical Services Authority, and those sorts of agencies. Now let's talk about the California Public Health and Medical Emergency Operations Manual. And this document is really kind of what we refer to as the California Public Health and Medical Bible. This really is an operational document that shows exactly how we're supposed to respond within California. One of the programs it talks about within the EOM is the Medical Health Operational Area Coordination Program, or the MOLAC Program. And this program is really the point of contact and the center of gravity for the operational area. The other program that is really important within this document is the Regional Disaster Medical Health Specialist and Coordination Program. And this is really the main coordination program for the regional level. So we'll talk a little bit more about these 2 programs a couple slides later.
California has been broken up into 58 counties, or as SEMS likes to call them, operational areas. Each operational area contains a MOAC program.
So let's talk a little bit more about the MOAC program and some of the coordination functions that are included. So there's 17 different functions that the MOAC program has to fulfill. So it really can't just be one person. So we really call it, it's not just a person, it's a program. Everything including assessment of medical needs, coordination of disaster, medical and health resources, all the way down to coordination of non-fire-based pre-hospital EMS and establishment of temporary field treatment sites. The full list of the functions and the statute can be found in Health and Safety Code 1797.153.
So those 58 operational areas in California have been further divided up into 6 mutual aid regions. But taking it one step further, those 6 mutual aid regions have further been divided up into administrative regions: the coastal region, the inland region, and the southern region.
So how does the regional coordination look? So let's talk a little bit about that. The RDMHC program, Regional Disaster Medical Health Coordination Program, includes multiple functions, including supporting the EOM, supporting the MOAC programs, and then developing disaster plans within the state of California, and also responding to any mutual aid requests within the state. And then the leads at the state level are the EMS Authority and the California Department of Public Health. So the EMS Authority is responsible for the lead department for disaster medical, ESF8, and then CDPH functions as the lead for public and environmental health response at the state. So let's kind of talk about how information flows during a disaster. So everything flows from the bottom up. The MOLAC program and the RDMHC programs, they're doing the coordination at the operational area and at the region. And then they flow information up to the State Operations Center at the ESF8 desk, or the Medical Health Desk. The Med Health Desk then triages that information, figures out where is the best place to route that information, and then works with the Medical Health Coordination Center, or the MHCC, to verify and assess that information and then collect it. Lastly, the MHCC works with 3 separate department operations centers, or sub-operation centers, to disseminate that information: the EMSA doc, the CDPH RSS, and the DHCS doc, which does behavioral health.
This concludes Section 2 of the California Patient Movement Plan. Up next, we're going to talk about patient movement functions. Thank you.
All right, sounds good.